And I'm so happy to be here with you all. Um, I'm having a moment just listening to Heather kind of reflecting on the last 3 months and what it's been like to bring this event together. I'm looking at, well, I can't see your chat yet, all of the people here in the room with us right now, and just really marveling at the teams that have come together, and feeling deeply grateful that so many of you have made your way here on a Friday, perhaps very early in the morning, perhaps very late in the afternoon. So thank you for being here. And I'll say there's been a huge team working to organize this, from our organizing team to our initial advisors that were helping to plan the vision and the scope of the event, to all of our presenters. So on behalf of everyone that's been involved, thank you so much for taking the time and for being here and for being present. As Heather said, I'm Chelsea, and I head up the Give Back Yoga Foundation in the UK. So I'm based in London. You can see flats behind me. I also serve as Director of Strategy for our US nonprofit. And originally I came to Give Back Yoga as the founder of Eat, Breathe, Thrive, which is one of 5 small organizations that work under the Give Back Yoga Foundation umbrella. And I guess I'll just say there was something that Heather said in her opening talk that really struck me as the through line between our 2 organizations. And I'll also point out, I think it was the catalyst for creating this symposium to begin with. And that line was, yoga changed my life. This is something Heather and I share. Yoga certainly changed my life. I would venture to say it even saved my life, which might sound hyperbolic, but I know in my heart that to be true. And I would imagine that if you are here at this event today, there may be some aspect of that phrase that's true for you as well. You know, perhaps something in this practice or one of these teachings has in some way changed or shifted your own life. And it could be in a really big, dramatic way, or it could just be that when you're able to get to the mat, it changes your life in a small way. And you know how big a difference that small change can make in your day and in your family and in your community at large. Yoga changed my life is a sentiment that we hear and we've heard in our 14 years, coming on 15 years, I keep trying to round up, 14 years of work at the Give Back Yoga Foundation over and over and over again. It's something we hear from people with vastly different life experiences, people in prisons, people in addiction recovery centers, people in VAs, people in eating disorder treatment centers, which is where I first discovered the practice of yoga. Yoga changed my life. Over and over and over again, we hear that. And over the past 14 years, that sentiment has been what's driven us and driven our mission forward. It's the sentiment that led us to team up on this conference with Heather and the Yoga and Healthcare Alliance team. Over the years, we've actually sent over 20,000 yoga mats. Can you imagine 20,000 yoga mats in one space? That's a ton of yoga mats. We've trained over 10,000 yoga teachers to offer this practice, knowing that 45 minutes of stretching, of breathing, of being in one's body with mindful awareness can change a life and perhaps even save a life. And I guess, you know, this may be controversial to say, maybe even in my own organization, but I've often thought that that work that we've done of sending yoga mats, of training teachers, of giving small grants, is really only scratching the surface of what's possible. Over the years, I've learned, and I think we as an organization have learned, that one of the greatest barriers to accessing yoga, to accessing what I think is a life-changing practice, is cost. And of course, cost is tied up with all the same economic and cultural and social and historical contexts and circumstances that we are swimming in today, which you'll hear about more in our panel today on health inequalities, which is led by 4 wonderful experts in this field. So it's not just cost, but of course the systems that influence cost. But cost is a huge barrier. The truth is that most people in the world cannot afford a weekly yoga class at the prices that they're charged in London or in LA, where I used to live. We know it's a life-changing practice, but we know that most people don't show up, yes, because of the image of yoga, yes, all of those things, but because it's expensive. I often think when I talk about this about me at 16 years old. I was in foster care. Because I was in foster care, I had access to Medicaid, which is the only form of state-funded healthcare in the US. And if it hadn't been for Medicaid, if it hadn't been for healthcare, I would never have shown up in a yoga class. That was my first introduction to a practice that went on to save my life. And I think this is where our two organizations, the Yoga and Healthcare Alliance and the Give Back Yoga Foundation, align. And this is what we discovered in February when Heather reached out to us and said, hey, we want to do something. We know something can be done, and we want to work with you. And I will say for, two different organizations on two different sides of the Atlantic with different goals, different aims, different work styles, different teams, collaboration can sometimes be hard and complicated and difficult. But we decided to work together because we knew we had a shared mission, we had a shared purpose, and we believed that getting yoga into healthcare could make such a difference in ensuring that someone who can really benefit from this practice has access to it. And I said, like, my heart's beating really fast because I would not have accessed this practice if it hadn't been for healthcare. And I came to the UK 2 years ago to set up the Give Back Yoga Foundation as a registered charity in the UK because there's a national healthcare service. And any person, regardless of economic circumstance, regardless of their employment status, can access healthcare. And I wanted yoga to be a part of healthcare. And that's something that Yeehaw, Heather, Paul, the entire team organizing in this conference shares. We know how important yoga can be in a crisis. And we don't think yoga is a panacea. We don't think it's going to cure COVID, but we know what a difference it can make. We believe in that. And that's why we brought so many different organizations and so many different presenters together, is because we know. And we also know that collaboration is going to be key to getting this conversation to a global stage. We know that conversation, but collaboration is going to be key to changing policy and to ensuring yoga is an important part of healthcare in a way that's grounded in integrity, if I may say that, based on research, based on the best evidence in our field. And I think the last thing I'll say before I introduce you to the wonderful members of our team and hand it back to Heather is that in a global crisis, all of the health inequalities have been laid bare. The mental health crisis that Heather spoke to, yes, it's been exacerbated, but really it's been revealed. We've had a healthcare system that's not been great at treating mental health for a long time. Now we've got new conditions emerging. So we brought you here. We brought this entire group of presenters and institutions together because we know what an opportunity this moment is. Yes, it is a crisis, and yes, it's heartbreaking, and we've lost loved ones, we've lost jobs, we've lost employment, but also I see this as a real opportunity for our field to come together, to pool resources, to work collectively to figure out what do we know about this practice, how can we fit into healthcare, and to bring all of the healthcare providers together in that conversation, and to ensure that this practice can be available to every single person who can benefit from it, who might also later say, yoga changed my life or yoga saved my life.